Welcome to the Health Science Coach Podcast. My name is Drew Garner, and I'm a health science and physical education teacher. This is a podcast to help students, parents, and recent graduates learn about pathways into healthcare and sports medicine careers. These industry professionals lay out how their experiences have helped them get to where they are now. If you enjoy this content, please subscribe to the channel or download through your podcast player. Thanks again for spending some time with us today. Now let's dig in. Today, we get the pleasure of meeting with Becky Wiseman. She is a clinical social worker at Children's Mercy Hospital and works with young athletes on their mental health. Welcome, Becky. How are you doing today?
I'm good. Thank you for having me.
Absolutely. Thanks for coming on and talking about, what you do for young athletes and getting them back into playing form. Can you give us some detail what it means to be a clinical social worker?
Absolutely. So once you have your clinical license, basically that allows you the ability to diagnose and also then bill insurance. So it kind of takes you to a form where you can licensed and legally do therapy within the states that you're licensed in. So I'm licensed in both Kansas and Missouri. And in order to do that, you go through the state and get your professional license. But that allows me to do individual, family, group therapy, and in a number of different settings. So it can be school, hospitals, mental health centers, and kind of it gives you an ability to work with a number of populations, which I really like.
That's pretty cool. So with that, being able to work with families and teams and individuals, what's a typical, week in the life of your profession at Children's Mercy?
Absolutely. So I work within the Sports Medicine Center. So I have two locations. One is in the Blue Valley area, and so it's a little bit further south. And then my other is at the Village West location. And the Sports Medicine Center was developed in order to really serve the population of athletes. And in our area, we have a number of youth athletes, and it's a really high competitive area in a number of sports. So with what it kind of looks like for me is I do get referrals from providers within sports med. So providers would include doctors, surgeon, physical therapist, and also athletic trainers who are stationed within the schools. So they may meet with an athlete who could possibly be out for a number of months because of their injury. So an ACL injury is typically one that takes, several months to return to play. Yeah. And so someone who is very active in their sport with their scheduling, competitiveness, that can be a huge adjustment. So I will get that referral and then we make contact with the family. Sometimes I am on a waiting list. I try really, really hard not to because it is time sensitive. So when something happens, such as injury, I want to get people in as soon as I can. But I will oftentimes meet with individual athletes. I may meet with their families initially just to kind of discuss what I do and who I am and how I work. And then after that, we set some goals of what they would like to do and what they would like to see through this process, and ultimately how they would like to finish up the process. And I will do individual therapy, typically I have anywhere from usually about 5 sessions a day. So those are about an hour long. And with that is the documentation, and documentation within a hospital is incredibly important. And they take it very seriously. So I have, so sometimes the documentation can be a little heavier than what I would like. And then any follow-up that I need with doctors or physical therapists or families who call. So much of my day is spent communicating on some level in some form. A lot of it is direct one-on-one, but I also, utilize email quite a bit, phone, and I know young people are like, phone, but I am on phone quite a bit, just making those contacts. So that's what a typical day looks like in my world.
Yeah, that's pretty cool. just being able to see, how the athletes come in and be able to, like you said, the time sensitivity of it and being able to, you know, return to play safely emotionally is also extremely important. So you got your undergraduate at the University of Kansas and you
Yes.
studied there, and you studied family development and juvenile law. Let's kind of talk about what that degree looks like and why you kind of chose that.
So I started with in college, actually going to school undergrad, not really knowing what I wanted to do. I had a general idea of wanting to be in a helping profession. So initially, my mom worked in the medical field. So initially, I kind of thought, well, maybe, nursing, which was quickly eliminated because my gag reflex and ability to deal with blood or anything else is very minimal. So I quickly kind of looked also into teaching and things along those lines because, again, I knew I wanted to work with people. But I was drawn to more of the behavioral component, and that's what family development, a lot of was behaviorally. So why we do what we do, what are the functions of our behavior, what reinforces our behavior. So that was kind of my early study, and with that, just kind of naturally got into juvenile law, just really learning about the laws within the juvenile system and really found that fascinating. It changes quickly, which I liked kind of knowing the different changes and why those changes come about with juvenile law and how over the years it went from very punishing. At the start of juvenile law was very punishing in nature and then moved more into finding resources and having people be able to change their lives as a youngster rather than labeling them for the rest of their lives for a decision they made when they were 16. So I really loved that process. So that behavioral component and with the corrections component was really interesting to me. And that's kind of where I got started in my field of practice. And then after that, realized I really want to go get my master's in order to do the direct counseling, the direct care that I ultimately saw myself doing.
Yeah. So after you graduated with your undergraduate, you went to work for a couple of years. Let's talk about what you did after graduation that led you to wanting to go back to get your master's, like you mentioned.
Sure. So during college, I got my probably most intensive experience working with individuals, and I happened to work with adolescents at that point. And so that was working in a group home with kids who had been removed from their home. So there was a variety of behaviors, a variety of traumas, a variety of family situations. And, it was just really amazing work to find out like how difficult this work is, but also how rewarding. And so I was kind of hooked there in college. And then my first job out of college was at Juvenile Intake and Assessment that's located in Olathe, Kansas. And so basically what would happen kids would be arrested, and then they would come to the assessment center where I worked, and we would talk with the kids, get a little background, get a little understanding of kind of what they have going on in their lives, what support they have, what support they may need. And then I had the job of calling parents and saying, hey, I have your child. They've been arrested. Come on in. We're going to turn them back to you. And so what we oftentimes did was just allow a little bit of a lot of bit of crisis management of, this is what's going on. These will be the next steps. Here's who you will hear from next. And if there's any resources needed. So if the family came in and said, he was taking something because we don't have the money at home we don't have any food at home. And so that's what this was about. then we'd be able to offer resources and connect them with resources within the community. And that was a big part of our work. Yes, I mean, it was with the start of, yes, you've been arrested, you're coming and getting your mug shots and fingerprints, which is all really, really scary. But I hope they felt we were sensitive to that. It wasn't my job to scold anyone. It was my job more of saying, what's going on that led you to see me here today?
Right.
And so trying to support the family through that, because ultimately we don't want them going through the court system. If we can avoid that, then that's best. But with working with that, what I really enjoyed is the one-on-one component with both teenagers and their families. And
Right.
so as I did that, I kind of felt like that's more, I want to do more of that. And that's what led me stepping into getting my master's in social work, because I knew ultimately that I could do one-on-one care therapy thereafter.
So, with your master's program, you also went to the University of Kansas for that as well, and you studied social welfare. Um, what's that kind of program look like as far as a degree in terms of maybe years and some classes that you take?
That's a great question. So there's very different avenues within a lot of the different colleges that offer masters in social work, and more around this area do offer that. I'm most familiar with KU and UMKC because those are the programs that either I have been involved in or I've had students come in, and I'll kind of explain that a little bit. So a lot of what the programming about is just kind of the understanding of people within their environment and what happens with people within their environment. And that is a big push for social work. It's not just about what's going on with the person, but what's happening around them that is, then creating that. So a lot of social justice classes, a lot of policy classes, and me already kind of being interested in law, that fit really well.
Right.
Um, so, classes about how policies are developed. And then you get into more of your practice classes. So some people go down a road of doing this advanced within 1 year. So they do a 1 year program, a 1 year master's program, and that takes special acceptance.
Yeah.
I had to work. So my parents had cut me off. So I needed to have a full-time job and do my master's program. So I did the part-time. And so that actually took me 3 years to complete. But a lot of
Okay.
people can finish it in two. But the number of hours I was working, I needed to do the part-time program. So I did mine in 3 years. So the first two were classroom learning, policy classes, and then you move into more of your practice classes where you're learning therapeutic models and how to apply therapeutic models with your clients. And then the last year you do less in-class work, and what you do a practicum. And so the practicum study is actually going into an organization or an agency and working within that and doing the work, which was fantastic. And that was so important for me, being able to graduate feeling confident about moving into my career. So I did my practicum at Crittenton. I think it was Crittenton Behavioral Health. I'm not sure what it's called now, but it was an inpatient psychiatric hospital, and it still remains that. I worked in a residential, so the kids were there longer, so they could be there up several months. There's another part of Crittenton, which is acute, meaning you're there for a couple days, we're really stabilizing, and then you're back in your homes. The individuals I worked with were going to be there a longer term, and so many of the clients I worked with had been there several months.
Okay. Yeah, that makes a lot of sense. So after doing this, you kind of switch roles a little bit and go from working with individuals into sports medicine.
Mm-hmm.
What kind of made that jump for you, kind of wanting to get into the sports medicine and working with young athletes?
So I had, prior to making the leap, I worked in a school system. I worked at a public school for about 8 years. I was their social personal counselor. And
Right.
so I met with students, pretty much throughout the day. And a lot of those students were athletes. And so I worked with students, athletes, athletic trainers, coaches, and so that was kind of, I got my, working with individuals, kind of that was my first experience. And then I just so happened to marry a coach and an athlete. So he was big into sports. And so that kind of got a little bit more acknowledgement from that. And then had my own children. And they, of course, got into sports. And so I just kind of saw the progression of what happens when you're first starting out until you get into a really high competitive level. And so that was probably my biggest experience with that, but also working with some students who were athletes at a very elite level within their sport, and just kind of what that looked like to be a student athlete trying to maintain their schedule, trying to maintain their tryouts or their practice schedules, their teammates, their coaches. Like, so many personalities go into their world, but also how dedicated they were and how committed they were to their sport. And so I knew that going into applying for the position at Children's Mercy. And it was my kind of population that I'd had a lot of experience with. And so what I really liked about the position here at Children's Mercy is it was with athletes, but it was a lot of adjustment disorder. So you had a lot of kids who really had utilized their sport for coping. So they dealt with their stress. They dealt with, social conflict. They dealt with friendships out on the field or on the court, or on the stage. And so once that stopped because of injury, then it was like, I'm not really sure how to deal with these feelings. Also, a lot of identity was part of their, I mean, you're a soccer player, you're a football player, you're basketball, you're baseball. And so a lot of their identity is part of their sports and a lot of their social situation. And so when that comes to a stop, then it is really disruptive. And so really helping during that adjustment period, to help them get back to where they want to be competitively. And most of my athletes want to get back. Most of my athletes that I work with they want to get back to their competitive level.
Absolutely. So, you talked a little bit about how you got into it in the sport and, just really seeing it at the school level and getting into children's. What is it that you find like really personally rewarding of your new position?
Well, and I kind of have a little bit of a split position, and sorry I didn't mention this before. So part of my position is with the sports med department, working with my athletes. And then the other part of my position is working with Sporting Kansas City with the players and athletes there. So working with, the first team, second team, and the academy players, which are the developmental players. So what I really enjoy now is I kind of have a mix, from adults and professional players and kind of the life that they're experiencing, all the way down to, someone who's just kind of entering into what they want to do in sports. So I have such a wide range. As far as rewarding, like, I always appreciate when people allow me to be part of their story. And, unfortunately, when they come to me, I guess fortunately and unfortunately, they're at some of the hardest times of their lives. Like, this is some of the hardest things that they have dealt with. And, they know they're strong. They know they have things, but, kind of this day after day, like, is this going to be okay? Am I going to be able to play? Am I going to be the player that I was? Getting back to the point where people, do trust themselves, believe in themselves, believe in their recovery, and are able to return is really such a great thing. But it's also where some players, during this time of injury, discover there's other things about me that I really kind of want to lean into. And I wouldn't have known that unless I had this time of injury. So I think anyone who can kind of come from that and grow in that process is incredibly rewarding. And I think, what I love about the athletic population is they do always want to improve. They always want to get a little bit better. And so I certainly appreciate that, because that's not an easy ask. And so that's with both my professional, and my non-professional players is, I just want to be the best I can be. And I really love that piece, and them giving themselves that permission to get better at what they do. So it's a really rewarding population to work with, for sure.
Absolutely. Like you said, especially as younger athletes, they have had so few life experiences as compared to a professional athlete. And, some of the sporting guys, the professional guys, are pretty young also, versus, a professional baseball player, in their late 30s or something like that, but just
Right.
had those life experiences of being able to overcome and achieve and grow through that. I think that's pretty cool, like you mentioned.
Yeah, absolutely. Yeah, some players are signed when they're, 16, 17. And so, you're kind of entering into you are entering into a professional world, and that's without the experience of even maybe finishing high school or college, where a lot of us kind of grow during that period. So
Yeah.
it's kind of fast tracked, but the expectation is, you come in ready and prepared. So that is a lot. And part of discussions is how do we prepare when we're asking them to be at a professional level? How are we preparing them to be ready to do so? Is a really important piece of that.
What are some misconceptions that you think people might have about family sports therapy?
I don't know a lot about the misconceptions. I think a lot of it is maybe just that it's all performance based, which, there is a huge component of performance based. So when I'm talking with an athlete about anxiety, performance anxiety, is it performance based? You bet. But is there also a component of, like, how am I living my best life? And how am I, growing as an individual? So even off the field. So a lot of it, really, if there's things affecting you on the field, they're going to affect, your life off the field, and vice versa. So, I think the thought that it's just only performance based, it's only about making a person a better athlete, is probably the misconception. It really is helping a person become what they want to become, and helping them, move through any barriers that they see or that they have in their lives. So I think that's probably the biggest misconception. I think the biggest misconception about social work is that, we are the people that just come knocking on the door and taking your children.
Right.
And that that unfortunately is one that kind of has probably stuck around. Certainly there are social workers who work within child protection, and that's a tough job. Like, kudos, that is a very, very tough job. But the knowing that you also can be a therapist, you also can work, in a school or mental health center or an athletic, on the athletic side. It really is about knowing and connecting with people and helping them get to where they want to get to.
So, what are some things that you might be most proud of professionally, like something that you've achieved that you are really excited that you were able to do?
I think for me, it is, I've been in the field for a good long time. I think certainly getting my clinical license was, kind of the top of where I wanted to achieve, um, for my education, for my certifications, for my licensure. That was kind of that top place. So, with that, I'm
Right.
very, very proud of. But I also think, I've been in the field long enough, and have seen, um, you know, enough individuals that I feel confident in what I do. And so when someone walks through my door and says, I need your help, that I feel like I can say, okay, we can do that together. We can work on that together. So I think that feels what I'm most proud of is that, I really do feel confidence that I'm going to give that individual as much as I can and as much experience and as much advice and support that I feel like I can. And I feel like professionally, I'm in that place now.
Yeah, that's awesome. So with that clinical license, let's talk a little bit about that. I know that you had mentioned you have to do 4,000 hours of work with that to get your license. Can you explain what those hours look like and what getting your license entails?
Yes. So once you have your master's, then you can take an exam. And on the Kansas side, then you're a licensed master social work. So there's some things that you can do within that realm, actually quite a bit that you can do within that realm. On the Missouri side, it is a provisional license. So once you get your master's, then you have a provisional license. So either Kansas or Missouri, if you want to work with people in a therapeutic setting, you will have to get your clinical license. So what that means is having a job after school, going in, getting a job, and then seeing individuals on a regular basis. So I couldn't have graduated and got a desk job where I was, just doing data or things like that. I needed to be directly working with clients. And so um, you get a job with that, and then you have to get a clinical supervisor. So I worked with a clinical supervisor that I met with weekly for 2 years, who we would discuss cases, who he would give me feedback, kind of question areas where of practice. And so that was really helpful, again, as I was starting and meeting with people, that I could have a supervisor that I could speak directly to in times of question. And so once you complete the hours needed, and it takes about 2.5 years, then you can take your clinical license. And so there's around two big licensings, that you kind of have to go through. And they're just like any other licensure tests. They're not extremely fun. But you can you can take them. I think there's a certain number of times that you can take them, but you can study for them, and your undergrad or your grad school should really help support you being able to pass your licensure. So with clinical license, that's supposed to help you be able to support your licensure with that. So yeah, I mean, it is a process. You have to write up a contract that's pretty intricate and intense, and follow that closely, because in the world of social work, it really is about integrity. And it is about following your code of ethics, which we all agree, once we get into the profession, to follow our code of ethics. And that's for the safety of the people we work with. That's for the safety of the clients who are entrusting us with their story and entrusting us to help them.
Yeah, absolutely. Is there anything that you need to do yearly or bi-yearly to keep that license up?
Mm-hmm. So every 2 years, I have to renew my licensure. And with that, I have to have 40 hours of continuing education. So that's oftentimes the hospital offers that type of training for their social work department. So that's really helpful. But outside of that, if I can ask the hospital to pay for some of my training, but some of it I do pay for out of pocket. Um, so you have 40 hours every 2 years, and then 6 of those hours have to be in diagnostic. So I have to be learning what's new diagnostically, and changes that are happening within that psychiatric world. And then 3 of those hours have to be ethics based. So it has to be something surrounding the ethics of the work that we do. And then the rest can kind of be a variety of things. But I always look for trainings that are that coincide with what I'm doing, and kind of things change, and I've been out a long time. I haven't been to school for a really long time, so I appreciate going and hearing kind of what's new and what's happening, and the newest front. And I follow a model pretty closely that I utilize. It's evidence-based model that I really like, and it fits very well with the populations that I work with. And so whenever I see trainings about that, I'm always like, sign me up. But yeah, it's you have to keep on that, because that is your responsibility to know when your license is due. And when you have multiple states, then you can have multiple applications. So I have to every year or every 2 years renew with Kansas, every 2 years renew with Missouri, and they both cost money. So it's a charge each time.
Right. So with that, with your professional development, what are some of the industry trends? Like you said, you've been out school wise to learn about it for a while. What does that kind of trending look like with the psychology stuff going on right now?
I think, what I kind of feel like is a lot of the models that are coming out are really based on, looking at, yes, there are painful things that happen in our world, certainly traumatic things. And some people experience, years and years of trauma. And, kind of a way of, not an older form of practice, but a very used form of practice was, just to kind of change our thinking about that. And if we can change our thinking, then we can change our behavior, then things will, kind of progress. One of the models that I use, which I guess would be it's considered a third wave from cognitive behavioral therapy. I utilize the acceptance and commitment theory. And really, that's not necessarily changing anything about our thinking. It's more of accepting our thinking and emotions about things that happen to us. So if really painful things happen, to, kind of identify, yeah, that's really hurtful. That hurts. It's painful. I can accept that feeling. I can accept that, this is painful. It makes me sad. It makes me want to stay in bed. And then I can commit to actions that ultimately are how I live, my most valued life. So even if I have pain, I can still commit to things where are valued driven by my life. And so that's the model I utilize quite a bit, and it would be considered a newer model. The
Okay.
mindfulness model is another model that's very utilized, and I utilize it in my practice all the time, and with my professional guys all the time, which is mindfulness is about kind of the whole idea is paying attention on purpose,
Mhm.
being present in the moment rather than finding ourselves caught in our worry or thinking about things of the past, but just being very present in where we're at in our reality, and accepting whatever that is. So with mindfulness, a practice may be, while I'm brushing my teeth, I only brush my teeth. And so as my mind wanders, I just bring it back to brushing my teeth. And my mind wanders, I bring it back. So a lot of times people get irritated with meditation because they're like, as soon as I get quiet, my mind goes a million places. Well, of course, we're
Yep.
human. That's exactly what things happen. What the training, or I call the money shot, is being able to bring it back to the present. So let your mind go wherever it goes, accept it, and then bring it back to what you're doing within the moment.
Absolutely. Yeah. I think, I've found that with swim class, kids are swimming and, they'll be thinking about something and not remembering what they're supposed to be doing as they're swimming their
Yes.
lap. So just bringing that back into what you're doing now and controlling what you can do with the now. Um,
Yes, for sure.
so you've been in the industry now for a while. What are some of your career goals there where you see yourself, maybe 5 to 10 years down the road professionally?
It's a really good question. so so I think, for me, I really have enjoyed, working with the population and feel like it's been a really strong fit. And so I could see myself continuing. Ultimately, at some point, I feel like, as in everything, you kind of age out. And so, the population I work with is a young population, and I certainly want to be able to feel connected, even though sometimes I'm like, Oh my gosh, I'm so old. But still stay connected a bit to that population and kind of understand a little bit about, what's happening within their world. I think when I feel like I'm no longer effective in that, I definitely want to be able to be in working maybe with a different population. But also I really have enjoyed consulting with coaches and for coaches to say, how do I work best with my players? How do I communicate best with my players? This is what we're trying to accomplish. What is some language I can use? I really have enjoyed that consultation piece of it, so could see that growing as well.
Yeah, absolutely. Um, what's something that you might have wished you had known in college or early on in high school that could help you with your career currently?
I think it's more of I look back and kind of realize how many things really coincide with what I'm doing now. I was definitely within my high school group. I was probably more they did call me. I'm like, it's not, I was, they called me the mother hen. And so I often was a person that people would come to and talk to for advice. And, I tended to have, kind of a non-judgmental approach to that and really was okay with everyone having the experiences that they're having and not feeling the need to change that. I mean, I can remember my thought process even way back in high school. And so just kind of knowing like that's valuable stuff. I didn't know it at the time.
Right.
People will be like, oh, here comes mother hen. And so, but I was protective of of my friends. I was protective of the people, around me and protective of their emotions and how they were feeling. And just kind of maybe knowing that that was going to grow into something that I really could feel proud about. And I think I was proud of it then, but I guess I just didn't connect those dots. So it just made me paying attention more of really what I was good at, because for a long time I was like, I have no idea what I'm going to do. I have no idea. Like I felt like everyone knew their path, and I'm like, um, so maybe just kind of relaxing a little bit of like, you don't have to have it all figured out, step one, into college. But really kind of thinking about what are the things that are very natural and organic to me, and how do I build upon those?
Right. So with that, we're going to look at a couple different questions that are kind of some advice questions.
Okay.
Um, and we'll look at, maybe just the general psychology realm of,
Uh-huh.
it could be social work, it could be sports psychology, it could be all that kind of stuff. But, for a high school student that's interested in getting into some sort of psychology profession potentially, what's some advice that you would have for them now, maybe as to where they could look for opportunities to shadow or stuff they should be concentrating on in school?
Yeah, I think it's always tricky with the shadowing piece of any therapy, because confidentiality is one of the highest um, you know oaths
Yep.
that we take, is that when you are in our office, it is confidential. So I do at times have people who are hired through Children's Mercy that are learning that their role come and hire or come and shadow. But I think it's hard for any in a therapeutic setting to find that shadowing opportunity. But I do think taking unfortunately, a lot of psychology within high school is very theory based. So you get a lot of like Piaget, Young, classical conditioning, which I kind of like because I'm a behavioralist by heart.
Right.
So I kind of geek out over that stuff, but it can be a little dry. So one of my favorite classes was really kind of getting more into what are the pathologies that we're looking at, and really getting into trauma training. I mean, that whole realm of trauma, I think, made me a better professional, but I think it also made me a better person in like dealing with people one on one, understanding what people are going through. So I would definitely encourage them, any classes that are available, to definitely do that, but also, just speaking with people. Like, I'm always happy to speak with people about, like, hey, have you thought about this? Have you thought about this population? This could be something. But I think, it is harder to get in and like watch people do it. But it's certainly, if you take the classes and kind of network with people who are doing it, they can kind of open up the doors to different areas of study.
Right. Yeah, absolutely. And now the kind of transfer into that, college undergraduate or grad student that is currently enrolled in classes and, wanting to pursue that degree. What advice would you have for them as far as, what to look for in their degree programs or kind of stuff like that?
I think if you're an undergraduate degree, I always believe there's a bit of, having your passion and your purpose. And so a passion may be something that you truly, truly love, and that you just you want to do that in your free time. You want to pursue that. And then, your purpose is, for me, like what you have to offer and what you can do. And so, really looking at bringing those passion and this purpose together, but also with the reality of, at some point I have to pay bills. So at some point, those student loans come due. So, not selling yourself short in what your next decisions are,
Right.
and taking your passion, but also bringing a purpose, having those combined in your decisions. So I think, looking for what is the pay, and, can I sustain that? Is that for me? And one of the things, I think in a helping profession in general is there's a lot of, we help people, so payment isn't as important. And to a point, that is true. I don't do this to be wealthy. It's not that road that I've gone down. But again, I don't think it's a bad thing to ask for our worth. And so as
Right.
you're looking at, what are the next steps for me, utilizing psychology in every aspect. I mean, you can go into accounting, you can go into communication, you can go into marketing, and understanding people's functioning is going to be helpful. So, you can certainly like psychology, but say, but you know what, I want to live in a big house and drive some nice cars. Well, take that knowledge, and, and you can certainly then, apply that to something that maybe is more financially lucrative. But I think, as far as looking for what are the populations that you like to work with, what are the populations that you're naturally drawn to? I always knew what we call the littles, so the little bitty guys. I knew I loved them, and I thought they were super cute, but communication wise, it wasn't as easy for me. And I also knew the older generation was not a generation I had a ton of experience with. So really looking at what population you want to work with, and then what are the issues within that population. What are the things that they're facing, and are you comfortable with that?
Right.
I don't have every experience, but I am certainly comfortable talking about anyone's experience. And if you're not, be aware of that. If you
Oh,
have really strong, rigid views about things, be aware of that, because, our first objective is to do absolutely no harm. And so if I have very, very strong views about certain things, and someone comes into my office and says, I want to talk about this, and I either try to persuade them in my belief or try to persuade them in their parent belief, then I'm really not doing my job.
right.
So know yourself well. And if there's things that you're like, I cannot, I'm not okay with that arena, know that about yourself, be okay with that, but certainly then question if this is the field to go into.
Yeah, absolutely. All of that, just being able to be confident and know that you're working for the patient, and you need to be
Yes,
able to help them regardless of what your ideas are based on whatever.
100%.
Yeah.
Yep.
Um, what about a recent graduate looking for a job, or somebody that's getting ready to graduate? Um, advice for them is what I mean, you kind of covered quite a bit of it, being able to look at that scope and sequence of, what is your purpose and what are you comfortable with inside of that age group and what are their issues. As an employee, somebody, if you're just hiring a new person to work with you, let's say, what are some of the main things they should be concentrating on their first 3 to 6 months in the industry?
I think, walking into, and Children's Mercy is a huge organization with a number of people, well established, their policies and their rules have all been, in place, or there has been multiple discussions before they've been put in place. So, it really wasn't my job to come in here and shake things up. At Children's, it has its reputation for a reason, and so really it was more of coming in and wanting to learn about the population, wanting to bring my experience, because I have been to several different settings, and so bring my experience from my school setting, from my psychiatric setting, from my private practice setting. And so knowing I had something to offer to this environment, but learning about the environment so I could plug it in properly. And so that, I think, is a really helpful thing. We all want to be impactful. We all want to make a difference. Absolutely. And sometimes that means taking a little bit of time and learning about the process and learning about how that works. And, patience is tough. But I think it can be most effective when we can say, here's the environment I'm working with, here's what I'm bringing to the table. And, let me give it some time before, I start really moving walls too much. But I think also letting, even if you are green, you still have life experiences and how those are going to help you. And how those are going to make you valuable for the people that you're working with.
Yeah, absolutely. So with that, I kind of have followed a bunch of different people through social media and podcasts and stuff. One of the resources that I've used as a coach, Dr. Andrew Jacobs, he's out of Kansas City here.
Yep.
What are some? He has a podcast that talks about a plethora of different topics and discussions that have helped me as a coach, deal with talking to young athletes. What are some advice? And I'm going to break this into three, but coaches, parents, and athletes, what is some advice or resources you think that could look at those type of people dealing like on the outside, before something happens to a player, or maybe helping them along the way of a player that's injured or something like that they could use if they don't have access to somebody like you?
Absolutely. I think, just as you mentioned, there are different podcasts and articles and books. One of my favorite books is kind of an oldie but a goodie. It's from George Mumford, and it's called The Mindful Athlete. And he is the sports psychologist who worked with the Bulls when, Michael Jordan and they were winning everything. So he was a sports psychologist then, and I really love his approach. Because again, he takes his life experiences and kind of puts them in a way of, even if you come from very difficult points, you can still be the person who knows how to regulate themselves, who knows how to take care, of their emotions. And one of the things I think a lot of times as an adult, watching our kids have strong emotions can sometimes make us uncomfortable. Like we want to jump in and kind of like help that out. But sometimes really just providing that space and, kind of validating like, yeah, I can see why you're frustrated. I can see why you're having a hard time with this person or with being injured. Why don't you tell me about that? So give him a little bit of space before we kind of go positive, like, oh yeah, but you only have 7 more months of this. Like 7 more months, you're going to be out there on the field and you're going to be doing great. It doesn't really teach us then how we deal with the bad feelings we're having right now. It just kind of says, we can't handle those, so go to really positive feelings. When what we really want to do is know, okay, we can have really negative experiences, really difficult experiences, and we can figure out how to deal with that, because down the road, yeah, we're going to be back out on that field. So I think coaches and parents in allowing that, some space for that sadness and that, disappointment, and saying, what is, tell me about that. Tell me about that disappointment. We don't have to fix it, because we can't fix it. I can't fix someone's ACL. I can't, make that repaired. Surgeons can do that, but they still have the recovery process. And I think for athletes, knowing that I can have really, really big emotions and I don't have to be reactive to it. Like, I can be incredibly frustrated. I can be incredibly sad. I can be incredibly embarrassed, and I don't have to be reactive to everything. I can kind of sit and say, that was so embarrassing. Like, I can't believe that just happened to me. Like, oh my gosh, but not quit the team,
Right.
not, storm off the field, not verbally attack our coaches, our referees, or, our teammates. We can experience really strong emotions and not have to be reactive to all of them. It's about honoring those, understanding those, kind of going, okay, yeah, I can see where that is, and then dealing with that. So I'm going to be present and do my next thing. Like, this emotion may come with me, but I'm going to be present and do my next thing. And the adults kind of allow them the knowledge of how to deal with that process.
Yeah, absolutely. I think that really sums up a good scenario of, the mindfulness of, not overreacting and blowing up and letting that cause to other issues off the field, especially with how that student athlete or that young athlete may identify, like we talked about earlier. And I think that's really important.
Yeah.
Couple more questions for you, and I know we're be respectful of your time as well. If so, our athletic trainer kind of came up with this question: is if you dislike and if you like blank, then this is the right career path for you. So let's go ahead and start off with, if you dislike blank, then this is not the career path for you.
If you dislike people, then this is not the career path for you. If you dislike connecting with people, then this isn't something you would want to do. So if you really don't like to hear people's stories, you don't like to be a part of their stories, then this probably wouldn't be the best path for you to go down.
Yeah, absolutely. And then if you do like blank, then this is the right career path for you.
I would say if you like, I don't want it just to be the flip of if you don't like. I think
Right.
if you do appreciate people doing the best that they can, if you can appreciate people doing the best that they can, and and that may not always be a home run, but if you can appreciate that and if you can see the value in that, then this would be a great job for you. But it really is about understanding that people are doing the best that they can, and at the same time then asking them to do a little bit more. And so it's always like, you're doing a great job, you're doing the best that you can, and at the same time I'm going to ask you to do a little bit more. So yeah, I think that would be, if we can value people's experiences, it'd be a great job for you.
Absolutely a good scenario of, how to get into it and how to, really push through it. Last one is, if you have a mantra or quote that you kind of live your work or your life by.
I honestly think that a lot of my mantra and a lot of my how I live my life is probably from that mindfulness place of, we can only affect our reality. Our thinking is just our thinking. Our emotions are just our emotions. We have a million of them a day. And so really the only thing that we can affect is our present. And typically when we are in our present, it's usually not as awful as our thinking is. Like, our thinking is typically worse. So if we can really allow ourselves to be present, and appreciate our experiences in that, even painful ones, then I think we're going to be okay.
Yeah, absolutely. Well, Becky, thank you so much for spending this hour with us and talking about what you do and sharing with us about your experiences and your education. We really appreciate it.
You bet. Thank you so much for having me.
If you've made it this far into the episode, I want to thank you again for watching. Please subscribe, share, and comment below with any questions or comments you may have. If you're interested in more information about other professions within healthcare careers, please visit healthsciencecoach.com and talk to your school counselor or academic advisor. As always, stay happy, healthy, and live life with passion.